Health Check with Nurse Jenn is presented by Island Cancer Center.
Today, I'm Nurse Jenn. Tuberculosis, TB, is an ancient and resilient bacterial respiratory disease that can generally affect the lungs, but can also affect other parts of the body, such as the brain or spine. TB can spread from person to person through microscopic respiratory droplets released into the air. This can occur when an infected active TB person coughs, speaks, laughs, sings, sneezes, or spits within close proximity. The Guam Department of Public Health and Social Services requires all students and employees of the school system to get PPD tested. This mandate is also required from all healthcare professionals. It's a simple test that requires a small ant-like prick onto the forearm, and after 48 to 72 hours, if the injection site reacts with induration, raised, hardened swelling greater than 10 millimeters, will be referred to a doctor for additional testing. There are two types of TB, and it's important that you know the difference. The first type is non-contagious latent TB. It is also called sleeping TB because the germs will stay asleep as long as your body can fight them off. An individual may test positive for TB, but has a normal chest x-ray, hence it's sleeping. One cannot spread it to others. However, if diagnosed with latent TB, the individual will be still required to take a wide range of antibiotics. This restrictive medication regimen will lessen the chance of waking up the TB germs. The second type is contagious active TB. This TB germ is awake in one's body and can now spread to the lungs or other parts of the body, causing symptoms to arise. Symptoms include an abnormal chest x-ray, coughing up blood, chest pain, shortness of breath, fever, and chills. Tips to prevent the spread of TB include: avoid being in small closed spaces or rooms that are not well ventilated for long periods of time. Wearing a surgical mask to prevent the spread of germs when you're around people undergoing TB treatment or suspected of having tuberculosis. Most TB patients are cleared by a physician after the first 3 weeks of receiving an intensive, strict TB medication therapy as prescribed by Public Health. I'm Nurse Jenn reminding you, don't wreck yourself, health check yourself.
Health Check with Nurse Jenn is presented by Island Cancer Center.